degree from Texas A&M University at Corpus Christi, and her graduate degree from University of Texas Medical Branch in Galveston. Michelle has had over 500 hours in specialized training in the area of functional medicine, including blood, saliva, stool, and hair analysis, there's another big word, nutrigenomics, methylation pathway defects, detoxification, nutrition, homeopathy, and various other alternative medicine modalities. Michelle has been working in the DFW area for over 13 years, holding positions such as a transport nurse and a neonatal nurse practitioner in multiple neonatal intensive care units. During this period, Michelle championed in areas of patient safety, quality improvement, and alternative birth plans, including a delayed cord clamping implementation. Most recently, Michelle served as a program coordinator for a large, successful functional medicine office in the North Dallas area and currently serves as a founding board member for the national organization Nurses Against Mandatory Vaccines for Healthcare Personnel. Thank you so much, Michelle. Come on up. Thank you so much. And everyone that's walking by, these speakers are talking about your children too. Have questions, come and listen. This is about your future just as it is ours. Please come by and listen as well. Thank you so much, Michelle.
I'm going to wear two hats today because I'm going to talk about healthcare workers, and then I'm going to talk about children since I'm a provider that's treating children with autism and developmental delay, eczema, asthma, ADHD, chronic diseases, autoimmune diseases, all that kind of stuff. So I don't know if everybody is aware, but when you walk into a hospital now, every single personnel that's there is required to have a flu shot every year. There's no data supporting this, no studies showing that it works, and they all line up and do it. So you're now walking into a hospital where you're supposed to have autonomy over your decisions for yourself and for your children about what you would like to happen for them. What do you think that does? Do they think that they care about your healthcare decisions because they don't have any? And why? If the data isn't there, why are we doing it? Well, in the Affordable Care Act, they wrote into the Medicare and Medicaid reimbursement 2% bonus that if you don't have a certain number of your healthcare workers vaccinated for the flu, you lose out on that. So if you're a non-for-profit hospital, that could be make or break for you. And I have something to say to healthcare workers. We've been dealing with this for a really long time. From the moment that it happened, if everybody would have stand up and said, no, you're not going to inject me with mercury, formaldehyde, aluminum, animal parts, antibiotics, antifreeze, that's not going to happen. This would all be over. And I want to point out to healthcare workers that an injustice anywhere threatens justice everywhere. And I'm not really pulling any punches today, I'm looking at you. So when you're doing that and you roll up your sleeve and you say, well, I really want to pay my bills, you know, you're trickling down into the healthcare of every single person in the nation, and the most vulnerable of those people are the people that don't have a voice, and the largest of that group would be our children. A lot of hospitals out there feign giving a medical or religious exemption. Those don't usually go so well. I know someone with a history of breast cancer and autoimmune disease and all sorts of other things that had a successful medical exemption as a physician for the past several years, and last year they were denied. Not the healthcare person for that person, not their provider, but a group of doctors that doesn't even know this person all got together and decided, yeah, we're not going to go for that this year. Okay, that's the environment your healthcare workers are working in. It's not suitable to providing parents the ability to have autonomy or to be respected for their decisions. And so I want everyone to realize that. If you walk into a hospital and you see your healthcare provider wearing a mask, you should probably thank them for standing up for their rights and having their medical information that is supposed to be private shared with every single person that walks through that door as a worker or a visitor or a patient or a guest. We need to support those people. But really, nurses, I'm looking at you, you need to stand up for yourself, because when you don't, you're literally throwing these kids to the wolves. It all trickles down. Okay? And parents, that kid that was born with colic and screamed for 2 months straight, that's not normal. They're trying to tell you something. If you're going to a pediatrician and your child is screaming bloody murder 6, 12, 18 hours a day, and they tell you, well, babies scream, I suggest you collect your things and walk out the front door. Chronic infections, oh, it's daycare. It's not daycare. We all went to daycare. Were we sick all the time? Ear infections over and over again. Antibiotics, breathing treatments, steroids. Oh, now we have eczema, put some cream on it. Oh, well, we had eczema and it was this and this food. If anyone ever bothered to figure that out, usually they don't. But we outgrew it. Oh, except for now we have ADHD and we're impulsive and angry. Oh, the doctor said, I don't know. A lot of kids just need speech therapy now. That's the way it is. Or they need OT. Or your kid's lazy, that's why he has a misshapen head and needs a helmet. It's the most ridiculous thing I've heard lately. Okay, and they're all sitting around eating waffles for breakfast and snack packs all day. Wheat and cheese, macaroni and cheese, pizza, hot dogs. You take these kids that are trying to tell you, I have a problem, I have a problem, I have a problem, and you feed them junk, and they don't have the nutrition that they need. And then you're smothering them with Johnson & Johnson, who thinks it's totally cool for you to bathe your kid in formaldehyde for years before they decide to change it. And then you spray pesticides in your house. And then you have the Febreze and the Scentsy and the Airwick candles going, endocrine toxic. And then you take them to the doctor and they line up for 70 doses of shots in 18 years. And we wonder why 1 in 2 kids is having a serious problem in this country. I'm looking at parents now. All these people that are here today, we're not going to sit there in silence when you have your conversations about all your kids' therapies and that it's funny and y'all don't know why it's happening and neither does your doctor. We're going to start telling you to your face. Right? We're done with this. We're not going to sit around and pretend like these are things that just happen, because they're not. And the healthcare workers that know this, they need to stand up for it too. And so that's why we're here this year, and we're going to be here every year until we get this figured out. Thank you.